Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study that investigates the effects of a common practice among horse owners, soaking hay, on horses suffering from a severe form of asthma. This research, conducted by Roxanne Westerfeld and colleagues at the Université de Montréal and published in the Journal of Veterinary Internal Medicine in 2023, sheds light on how this simple intervention might impact the respiratory health of these animals. Severe equine asthma is a chronic inflammatory condition that can significantly affect a horse's well-being, leading to labored breathing, coughing, and an increased production of mucus in their airways. These clinical signs are often triggered or worsened by the inhalation of tiny particles present in their environment, particularly during feeding. These inhaled substances can include a variety of culprits such as endotoxins, mold spores, mites, and inorganic dust particles, all of which can contribute to inflammation within the delicate tissues of the lungs. It's well established that managing the dust levels in a horse's environment is crucial for the long-term control of asthma in these sensitive animals. To this end, many different feeding strategies have been explored, each with its own set of advantages and disadvantages. For instance, hay pellets are known to be effective in reducing dust exposure, but they can sometimes be more expensive than traditional hay and have even been linked to changes in a horse's behavior. Other strategies, like haylage, silage, steamed hay, or incorporating oil into the hay, often require specialized equipment or carry other risks, such as the potential for botulism if not handled correctly. Given these limitations, many horse owners have turned to a simpler method, soaking or briefly immersing hay in water. This practice is widely adopted with the aim of reducing the amount of respirable dust that becomes airborne when the horse eats. The way owners soak hay can vary considerably, from just a quick rinse to a prolonged soaking period lasting several hours, and sometimes the hay is merely hosed down. Previous research has indicated that soaking hay for even a relatively short duration, such as 10 to 30 minutes, can significantly reduce the number of respirable particles for a limited time, often up to a couple of hours. Soaking can also lead to a decrease, although not always statistically significant, in the levels of endotoxins and mold present in the hay. Anecdotal evidence from horse owners suggests that soaking hay can lead to a reduction in coughing and an overall improvement in the clinical signs of asthma in their horses. Despite this widespread practice and the reported benefits, there has been a lack of comprehensive scientific investigation into the direct effects of soaked hay on the actual lung function and the inflammatory processes within the airways of horses with severe asthma. Therefore, this study aimed to specifically measure how feeding soaked hay affects these critical parameters, as well as the overall clinical condition of horses suffering from this respiratory ailment. The researchers hypothesized that feeding soaked hay would indeed lead to improvements in lung function, reduce inflammation, and improve clinical scores, although they also proposed that these benefits might be less pronounced compared to feeding a diet consisting entirely of hay pellets. To conduct this investigation, the researchers enrolled 10 adult horses with a confirmed diagnosis of severe asthma from a dedicated research colony. These horses were experiencing a clinical flare-up of their asthma at the beginning of the study and were housed indoors for the duration of the 6-week trial. The horses were randomly divided into two groups. One group of 5 horses was fed soaked hay, while the other group of 5 horses received alfalfa pellets. The hay for the soaked hay group was completely submerged in cold water for a period of 45 minutes before being coarsely drained and fed at ground level in the horses' stalls. Importantly, any hay that was not consumed and had dried out was discarded before the next feeding, adhering to a strict protocol. The horses in the alfalfa pellet group were fed their pellets in a feeder. Throughout this 6-week study, the researchers diligently monitored the horses, taking various measurements at regular intervals. Pulmonary function and clinical scores were assessed before the study began, and then again at 2, 4, and 6 weeks. To evaluate the inflammatory state of the airways, tracheal mucus scores and bronchoalveolar lavages, a procedure to collect fluid samples from the deep airways, were performed at the beginning and at the end of the 6-week period. The data collected on lung function was then subjected to rigorous statistical analysis. The results of the study provided some interesting insights into the effects of soaked hay. When looking at the respiratory clinical scores, which were based on observations of nasal flaring and abdominal effort during breathing, both the soaked hay group and the alfalfa pellet group showed a gradual improvement over the 6 weeks. These scores decreased significantly in both groups, indicating a reduction in the visible signs of respiratory distress. However, the statistical analysis did not reveal any significant difference in the improvement of clinical scores between the two feeding regimens. Moving on to the objective measurements of lung function, the researchers assessed parameters such as lung resistance, transpulmonary pressure difference, and lung elastance. Lung resistance, in particular, showed a significant decrease over the 6-week period in the group that was fed soaked hay. Specifically, lung resistance decreased from a median of 1.89 cmH2O/L/S to 0.61 cmH2O/L/S in the soaked hay group, a statistically significant change. The alfalfa pellet group also experienced a decrease in lung resistance from 2.47 cmH2O/L/S to 1.59 cmH2O/L/S, but this change was not statistically significant after accounting for multiple comparisons. Interestingly, by the end of the study, a greater proportion of horses in the soaked hay group had all 3 key lung function parameters, transpulmonary pressure difference, lung resistance, and lung elastance, within the normal ranges compared to the pellet-fed group. To further investigate the state of the airways, the researchers also looked for evidence of residual bronchoconstriction, which is a narrowing of the airways that can persist even after some improvement. At the end of the study, they administered a bronchodilator medication and then remeasured lung function. In the alfalfa pellet group, there was a significant decrease in transpulmonary pressure difference and lung resistance after the bronchodilator was given, suggesting that these horses still had some degree of airway narrowing that could be reversed by medication. In contrast, the soaked hay group did not show significant changes in lung function after the bronchodilator, indicating less residual bronchoconstriction in this group. The study also examined the cellular composition of the fluid collected from the horse's lungs through bronchoalveolar lavage. At the beginning of the study, all horses had an elevated percentage of neutrophils, a type of inflammatory cell, in their lung fluid, which is characteristic of asthma. Notably, the pellet-fed group started with a significantly higher percentage of neutrophils compared to the soaked hay group. Over the course of the study, the percentage of neutrophils decreased in both groups. However, while this decrease was statistically significant in the pellet group, the reduction observed in the soaked hay group was not significant after statistical adjustments. By the end of the study, a slightly higher number of horses in the soaked hay group had neutrophil percentages below the commonly accepted thresholds for normal. Other inflammatory cells, such as mast cells and eosinophils, did not show significant differences between the groups or over time, with eosinophils being largely absent. Interestingly, the pellet group showed a significant increase in the proportion of macrophages and lymphocytes in their lung fluid at the end of the study compared to the beginning, while the soaked hay group only showed a significant increase in lymphocytes. Another important aspect evaluated was the amount of mucus present in the trachea. The researchers used an endoscopic scoring system to assess this. The results showed that the mucus score decreased gradually over time in the soaked hay group, indicating a reduction in mucus production. However, there was no significant change in the mucus scores in the alfalfa pellet group over the same period. Finally, the study also tracked the body weight of the horses. An interesting finding was that the horses in the soaked hay group experienced a significant decrease in body weight between the beginning and the end of the 6-week study, with an average loss of 20.5 kilograms. In contrast, there was no significant change in the body weight of the horses in the alfalfa pellet group. The researchers concluded that soaking hay can indeed be an effective strategy for controlling airway obstruction in horses with severe asthma. The improvements observed in respiratory clinical scores and lung function in the soaked hay group align with the anecdotal reports from owners who have noticed a reduction in coughing and an overall clinical improvement in their asthmatic horses when feeding soaked hay. The study highlights that the relatively high efficacy of hay soaking observed in this controlled setting might be attributed to the strict protocol followed, which included a 45-minute soaking time and the consistent removal of any leftover hay that had dried out. This rigorous approach is likely to reduce the amount of respirable dust more effectively than the more variable soaking practices employed by some horse owners, who might only briefly wet the hay or not consistently discard uneaten portions. Furthermore, the fact that improvements in clinical signs were noticeable only after 2 weeks suggests that owners might need to be patient before concluding whether this intervention is beneficial for their horse. The overall low-dust environment of the research facility, with horses housed on wood shavings, likely also contributed to the positive outcomes in both groups. Wood shavings are known to reduce respirable dust levels, and the combination of wood shavings with either soaked hay or hay pellets further minimizes dust exposure. This implies that the benefits observed in this study might be more pronounced than what could be achieved in a typical stable setting where other dust-generating activities might be ongoing. While both soaked hay and alfalfa pellets led to improvements in clinical signs and lung function, the effects on pulmonary inflammation, as measured by neutrophil counts in the lung fluid, were more complex. Although neutrophil percentages decreased in all horses over the study period, the higher baseline neutrophilia in the pellet group complicated the comparison. The persistence of some degree of neutrophilia in the soaked hay group could potentially be explained by a transient increase in respirable particles that might occur as the soaked hay begins to dry out. Although the strict removal of leftover hay in this study likely minimized this effect, it could be more relevant in typical barn management practices where leftover soaked hay might not be removed as diligently. Interestingly, the study did not find a strong correlation between neutrophil percentages and mucus scores, which is sometimes reported. The researchers speculated that the difference in head position during feeding, horses eating soaked hay from the ground versus pellets from a feeder, might have influenced mucus clearance in the trachea, potentially contributing to this observation. It's also possible that the 6-week study duration was not long enough to observe a complete normalization of pulmonary neutrophilia, as other studies have shown that it can take several months of environmental management to achieve this. The relatively small number of horses in each group, combined with the lower baseline neutrophilia in the soaked hay group, might also have limited the ability to detect a statistically significant decrease in this group. Despite the benefits observed with soaked hay, the study also highlights some practical limitations and potential drawbacks. Soaking hay is known to significantly increase the bacterial content, which raises concerns about increased exposure to endotoxins, either through ingestion or inhalation as the hay dries. Exposure to endotoxins can, in turn, lead to an increase in neutrophils in the lungs. Therefore, the rapid feeding of soaked hay and the removal of leftovers are crucial, although the study acknowledges that quantifying and managing leftover soaked hay in a typical stable environment can be labor-intensive. Furthermore, the disposal of the water used for soaking hay poses an environmental challenge, particularly in cold climates where it can freeze. The increased weight of soaked hay also makes it more difficult to handle. The significant weight loss observed in the soaked hay group is another important consideration. Soaking hay leads to a loss of water-soluble carbohydrates, minerals, and crude proteins, which reduces the caloric content of the feed. The extent of this nutrient loss can vary depending on the soaking time. Additionally, the changes in nutrient composition can affect the taste and palatability of the hay, potentially reducing consumption. While the weight loss in this study was not considered clinically problematic as the horses maintained a reasonable body condition, the researchers recommend careful monitoring of weight and the provision of mineral and vitamin supplements for horses fed soaked hay to avoid unintended weight loss. In conclusion, this study provides valuable evidence that soaking hay, when done according to a strict protocol, can improve clinical signs, lung function, and tracheal mucus scores in horses with severe asthma. However, the practical challenges associated with this method, including the labor involved, the potential for increased bacterial exposure, and the risk of weight loss, need to be carefully considered. Moreover, the effectiveness of feeding soaked hay might be limited in stables where not all horses are on a dust reduction program due to the continued presence of dust from handling dry hay for other animals. Nevertheless, soaked hay represents a viable alternative for managing severe equine asthma, particularly in situations where access to pasture is limited and other low-dust feed options like pellets, haylage, or oiled hay are not feasible due to medical or financial constraints. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.